Welcome back, everyone. This is Engineer Nazmul Hassan Mehdi. I would like to welcome everyone in the YouTube studio of the official YouTube platform of Clinical Engineering Association Bangladesh. The dear viewers, in each and every day, we have uploaded lots of uh, videos that will help the clinical engineering professionals in Bangladesh. And one of our aim of Clinical Engineering Association Bangladesh to spread the knowledge of clinical engineering and also to create the awareness of regarding clinical engineering and to spreading the knowledge, training, and research, etc. Uh, for spreading the clinical engineering knowledge in this field. So today's video is going to be a very interesting videos because in each and every day you got lots of uh, learning, lots of knowledge regarding the medical equipment, regarding the life cycle management of the medical equipment, regarding the responsibility of the clinical engineering and the preventive maintenance, and also the knowledge of repair, troubleshooting of various types of medical equipment. But the reason why this today's videos is very interesting because in the last meeting of FMB CED divisions, the CED chair, Fabiola, she told me that she wants videos from us, and that's why I'm just doing this video, especially from for our CED chair Fabiola, and also for the IFMB divisions members. And today I am going to tell the brief history of Clinical Engineering Association Bangladesh. Because each and every day you got lots of videos, but most of you don't know about the history of the Clinical Engineering Association Bangladesh, how this Clinical Engineering Association Bangladesh is formed, and what is the objective and what is the reason behind that. So I think today's videos is going to be very interesting. So I'm just starting. First of all, I want to discuss about the historical background of Clinical Engineering Association Bangladesh. Biomedical Engineering Department was introduced under the Electrical and Electronic Engineering Faculty, Khulna Engineering University and Technology, KUET, Khulna, Bangladesh in 2007. This department has been conducting post-graduation degree M.Sc, M.Phil, and Ph.D. in biomedical engineering over the years. More than 3 candidates have completed masters in science in biomedical engineering since 2012 under the supervision of Professor Dr. Mohiuddin Ahmad. Among 2 candidates moved towards abroad in order to obtain Ph.D. degree in biomedical engineering. Mr. Anwar Hossain has admitted in order to obtain Ph.D. degree in biomedical engineering in 2012 at KUET due to limitation of his family and nature of job. For the benefits of his motherland related to clinical engineering, healthcare technology management, he aimed to introduce clinical engineering professionals under the healthcare system. However, he has been invited by the first Forum of Asian Clinical Engineering, which was held in Osaka, College of Japan, and it was sponsored international conference for development of clinical engineering professionals for Asian countries. In 2013, he is advised by supervisor Professor Dr. M.D. Mohiuddin Ahmad and Professor Dr. Rafiqul, as well as to develop a module for producing clinical engineering professionals for lower middle income countries. Professor Dr. Mohiuddin and Professor Dr. Rafiqul and Mr. S.U. Yusuf of KUET has been provided adequate supports. Accordingly, he has published 4 international conference articles, and accordingly, he has attended different conferences such as ICoBME, ICEAB 2015, and ICT EICT 2015, and so on. Now, I'm going to give the introduction of Clinical Engineering Association Bangladesh. Several meetings, and I think from this introduction you will understand from where the roots of the clinical engineering establishment has happened. Several meetings were conducted by Mr. Mohiuddin Ahmad, MD Anwar Hossain, and AKM Rahman, and other healthcare professionals. 2 times, Mr. Hossain was invited by Excellency Ambassador Dr. Mahmoud by Ezat, the Bangladeshi office, the Arab Republic of Egypt. A presentation and research paper were represented by MD Anwar Hossain since 2015. In conference hall office for uplifting the program, the Deputy Secretary Admin, Dr. AKM Mukhlisur Rahman, becomes very impressed, and he also met the Excellency Ambassador Dr. Mahmoud Beyza, the Bangladeshi officer. Programs were arranged by the Dr. Engineer Hannan, Biomedical Engineer Consultant of America. Mr. S. Hannan visited the National Electromedical Equipment Maintenance and Training Center since 2014, and previously met with Mr. Hossain in his training group. An overview on medical equipment maintenance management of Bangladesh was presented by Mr. MD Anwar Hossain, and he felt very much interested to uplift the maintenance management of Bangladesh by introducing clinical engineering regulatory, and most of high officials were present on that session. Mr. Anwar and his Ph.D. supervisory team published more than 6 international conference papers and 4 international journal papers for enhancing the healthcare delivery performance for developing and middle-income countries like Bangladesh. For reference, all published papers have found in the Google browser. His journals paper have published in Scopus Journal, an Indian journal with good impact factors. 2 best research papers were published by Elsevier and Modern Applied Physics of Canada. Most of the conference papers were produced by IEEE Explorer, and which are still preserved by the IEEE Digital Library. According to a group of search results, outcomes of conference and allied members of IEB, IFMBE, CED, JACE, ICHTMC, CEASA, BME, BMEA, and employee of NIMU and TC. A proposal has been submitted to the Ministry of Health and Family Welfare by MD Anwar Hossain in consultation with his PhD since April 2016. Dr. Mohiuddin Ahmad called up a meeting to investigate report that has been submitted by Mr. MD Anwar Hossain in the conference room of NIMU and TC. 10 concerned and potential persons related were present there in 20 September 2016 for founding Clinical Engineering Association Bangladesh. And now I'm going to express what was the outcome of the meeting. After a long discussion, and country prospective members have proposed a name as Clinical Engineering Association for Health Technology, Bangladesh, and it has been accepted by vote of thanks. A founder committee to establish Clinical Engineering Association Bangladesh has been formed by vote of thanks. The founder members are shown in www.ceab.org.bd. This is our official website of Clinical Engineering Association Bangladesh. If you want to know about Clinical Engineering Bangladesh more, you can also visit this website. I am just telling the website again, www.ceab.org.bd. At the same time, the President, Vice President, and General Secretary has been submitted a proposal for the valid registration of CEADH since 2016. Due to limitations and barriers, CEAHT has been registered in 2017, and accordingly the activities have functioned. For representing the CEAHT is renamed as Clinical Engineering Association Bangladesh, and it is abbreviated as CEAB by the same registration number. So I think you already, I already told you all the history behind the formation of Clinical Engineering Association Bangladesh, and the when the Clinical Engineering Association Bangladesh has first formed, then the name of the Clinical Engineering Association Bangladesh was CEAHT, and after that the name has changed, and the name has changed, and it forms the name like this, the Clinical Engineering Association Bangladesh, CEAB, and we have a valid registration too. So I think this is the history of Clinical Engineering Association Bangladesh, and I think day by day we are just improving. We are spreading the knowledge of clinical engineering in Bangladesh. We are just creating lots of content so that the professional who are working in the health sector of Bangladesh, who are working in the medical devices, they can get the good knowledge, the how to maintain this medical equipment. We are also trying to spread the information, basic information that every people have to understand. So what is the importance of clinical engineering for a hospital? Because in the hospital, it's not like that. The patient, the general people is only the patient of the hospital. I think the people are the patient of the doctors in the hospital, but the medical device and equipments is the patient of clinical engineering. A clinical engineer. If a hospital don't have any clinical engineering department, I think the medical device will not, the preventive maintenance of the medical equipment will not be, will not help. And due to this, the lack of preventive maintenance, the machine will break down before the warranty period, and this is happening on their hospital who lacks the hospital who don't have any clinical engineering department, because the electrical device or the medical equipment need a regular maintenance. Without the regular maintenance and without the perfect training, because the user will fail to maintain the machine. That's why if a hospital have a clinical engineering department, they will check all the medical equipment regularly, so that they can provide the good outcome in case of patient treatment. And when they go under diagnosis through this medical device, they can get the good, the hospital or we can get the good result from the patient. Good result of the good recordings that comes from the patient body, and on the basis of this report, the doctor can provide the best treatment for the patient. But according to the global report, the clinical engineering department is not yet established in each and every hospital of Bangladesh. It's not like that we don't have any clinical engineer. There are many universities in Bangladesh. There is a biomedical engineering department, and there are some hospitals in Bangladesh which is well reputed. They have clinical engineers on their hospital, and that hospital are running very well. But it's a matter of sorrow that most of the hospital in Bangladesh, and public and private, they don't have any clinical engineering department. Because of this reason, the return on investment is not coming, and it's not like that we don't have any modern sophisticated equipment. In Bangladesh, we have all types of modern sophisticated equipment, but the man behind the machine is very important. It's not creditable to buy the medical equipment, buy the modern and sophisticated equipment. You will not get any benefit. You can buy the modern equipment from other countries, which other country use, but you don't have any manpower. You don't have any employer. You don't have any engineers who can run this, who have the training on that specific machine, and he can do the preventive maintenance regularly. He know how to, he know the safety and calibration and how to maintain this machine. So I think it's not creditable, and the patient will not get perfect care. And due to this reason, you can buy a modern medical equipment, but the patient will not get the proper care, and as well as the machine will not uh, perform well. So if this happens, then then the patient will not get care, and also the equipment will not run well. So in order to establish clinical engineers in Bangladesh, I would like to draw the kind attention to the IFMB CED, but they are continuously just helping us by guide, and they are also guiding us, and they are just showing us the way in which way we can go, and we can produce the clinical engineers. But I think in Bangladesh, as a clinical engineers, I think we need more training. We need modern training. We need higher education. So I'd like to draw the kind attention to the our IFMBCD. Please, you always guide us in various ways. So please, you also have to think about us, that how we can get the modern training, and I think how we can be a licensed clinical engineer. We can be a clinical engineer with a license. And also in Bangladesh, the person, if I don't tell anything about him, I think everything will not be valid. That is our honorable teacher, Dr. Engineer M.B. Anwar Hossain sir. He is leading us, and he is the person who worked day and night to establish the clinical engineer in Bangladesh, and to create the post for each and every hospital to produce clinical engineering in Bangladesh. And each and every day he is posting lots of videos, that what is the importance of clinical engineering, and what is the importance of clinical engineering department in each and every hospital. He's spreading the knowledge. Whenever he go, he always spread the knowledge. He always share the knowledge why it is important, as he is working in the very core position in the healthcare. He's trying hard. And our Professor Dr. Mohiuddin sir, he is also doing lots of research. And there are some people who are working day and night for the CEAB, Clinical Engineering Association Bangladesh. So today I will not extend the video. I just told, I think you you have some ideas about the history of clinical engineering. I think we are doing lots of research. Our upcoming lots of research is coming. And also the another thing is that in India, that we have an upcoming conference about clinical engineering, and I would like to invite you all to join the conference. And this is the fifth ICEHTM conference. This will happen in India, and I think there is a call for the abstract, and I think and the last day of sending the abstract is 31 March. and I'm just telling you the what is the topic, what will be the topic for of your research for sending the abstract. And number one is the pandemic solution. Number two, capacity building. Number three, impact management. Number four, credentialing. Number five, policy. Number six, digital health. Number seven, health technology management, HTM. Number eight, health technology innovation and assessment. Number nine, home care technology. Number 10, quality and risk management. Number 11, women in clinical engineering. And number 12, national CE societies. So these are the topics you can write your abstract, and you can send it. You can send it, and there is a guideline. Or you can comment below if you want to send the abstract. How you can send the abstract? I will send you the document, and you can comment on the comment on this video. Then I will send you the documents and the way how you will in which topics you will send the abstract, and how you will send. So, and this is all about these videos, and the conference will happen in November 1 to 4. So thank you everyone. Hope we will able to do some better content so that you can learn about clinical engineering. So thank you everyone.